Windy City After Dark, Chicagoan and recent winner of The Bachelor, Whitney Bischoff, is with us tonight, along with Colleen Coughlin, an embryologist and founder of aParent IVF, the fertility clinic that Whitney worked at in Highland Park. Thank you so much, ladies, for sticking around. And we talked to you earlier, Colleen, but I really love the fact that your business exists because you are helping women in an area that can be really tough and difficult achieve the ending goal, which is a baby.
It's wonderful, and I'm blessed. I've been doing this all here in Chicago, so I really know the Chicago woman throughout all of her the years that she's starting a family. To we even have some of our patients that are bringing their children that are getting married to start talking about some of their fertility options. So I'm really blessed to be in such a great field.
Well, you know, I've had a couple of friends actually go through the process of freezing their eggs. Is there when's the best time to do that, and when should you be thinking about it?
That's a great question. Ideally, it's done between about 25 and 35 because those are your peak fertility years. Egg freezing's actually been around for a very long time, but in the past, we used to just do it for patients that were undergoing cancer treatment. But we've been able to improve the technique. So it's now it's a game changer. We're basically able to take whatever that woman's potential is for her eggs at that age and fix it right there. So
you freeze them, right? You keep them young forever. It's a way to keep them young forever,
yes.
Right?
You go ahead and age, but your eggs don't have to.
Right. Now, how much are we talking about, Colleen?
Well, and it's not something that's done everywhere. So certainly on the East Coast, it's a little bit more expensive. Sure. But typically, per procedure to do it, it ranges from about $7,000. It could be all the way up to about $20,000. But $7,000 to $10,000 is about the typical price.
And a couple of my friends said some insurances cover a bit of it. And I have to tell you, have you seen an increase? Like, I think both of you could answer this, because a lot of women are waiting a lot longer to get married. So now, like, mid-30s, a lot of my friends are like freezing their eggs.
Yes, yes. And we typically have had the woman 38 to 42 that have been coming in initially with egg freezing. Is that too late? Well, it's still better than not having them frozen at all, but the earlier the better. And the reason we founded the Egg Bank Foundation is to let every woman know why she should at least consider it. And typically, most people think you're freezing your eggs for baby number one because you're busy with your career. Sure. But there's really many other reasons why people should know about it. It's basically anything that might get in the way with you. It's not necessarily for baby number one. It's for baby number two or baby number three. So that it empowers women with herself or her future husband to stop building their families when they're ready, not to take control of their own fertility.
Whitney, have you thought about doing this since you work in the profession?
I actually have walked the talk. So I froze my eggs about 3-4 years ago. Yeah.
Are there certain years where the eggs are better? I mean, I know the older you get, it's not genetic at all, right? It doesn't have anything to do with that. It's just basically pretty much your age.
Well, remember, we're born with all the eggs we're ever going to have. So men produce sperm throughout their whole lifetime. But when a baby girl is born, she's already lost a lot of her eggs. But that's it. That's all we're ever going to have. So as we're aging, we're losing a lot of numbers. But then the numbers that are remaining lose their quality as well.
Whitney, it's so cool that you did it. I did not know that. I mean, was it painful? Was it a difficult process?
You know, I think for me, because I was so educated on it, that it wasn't as bad as what people would think. And I think that's why I'm taking this stance, is because I feel like knowledge is power. So coming into it, it could seem like it's a very overwhelming process, but that's why there's people like me that sit down and can talk, you know, to another woman and explain that not only am I the nurse, but I've also been the patient. So, you know, it's very, the procedure itself is very, very quick, and the recovery is very quick as well. You know, there is somewhat of a time commitment in terms of, you know, giving yourself the hormonal drugs, which are injections, and having to go in and be monitored because you want to do it safely and correctly. So it is about a 10 to 14-day window period where you really have to be committed to this process.
Right. Do you think you'll use the eggs with your fiancé?
You know, it's an insurance
Or the old-fashioned way?
I think think the old-fashioned way is the way to start, you know, but it's an insurance policy. I mean, that's what this is. So, and it's the best insurance policy that I've ever purchased.
Right. Plus, the old-fashioned way is fun.
Oh, yeah.
Right. Yes. Have a good time doing it. But insurance is smart, and it allows you to take control of your own fertility and your destination. Ladies, thank you so much for being here with us.
Thanks again for having us.
Thank you. All the best to you as you get ready to start planning the wedding.
Thank you.
For more